12 weird sign of your pancreas is dying. The pancreas is an organ located behind the stomach. It produces the hormones insulin and glucagon. It also produces chemicals called enzymes needed to digest food. Most of the time, the enzymes are active only after they reach the small intestine. If these enzymes become active inside the pancreas, they can digest the tissue of the pancreas. This causes swelling, bleeding, and damage to the organ and its blood vessels. This problem is called acute pancreatitis. For the average person, these issues can cause a range of symptoms, affecting daily activities and overall well-being. They can also have ripple effects on other parts of the body. So let's start with our first early sign of pancreatic issues is abdominal pain stems from the intricate network of nerves surrounding the pancreas. When the pancreas becomes inflamed or develops tumors, it exerts pressure on these nerves, triggering pain signals. This discomfort typically manifests in the upper abdomen, near the center or slightly to the left, and can radiate to the back due to the pancreas' proximity to the spinal column. The pain may present as a dull ache, sharp stabbing sensation, or persistent discomfort, varying in intensity depending on the underlying cause. It's essential to differentiate pancreatic-related abdominal pain from other conditions. Pancreatic pain often worsens after eating or when lying down, whereas pain from other gastrointestinal issues may improve with food intake or position changes. Additionally, accompanying symptoms like nausea, vomiting, and jaundice can provide valuable clues to its pancreatic origin. Sign number 2 focuses on digestive troubles. The pancreas produces digestive enzymes crucial for breaking down food in the intestines. When the pancreas malfunctions, either due to inflammation or other issues, it can lead to insufficient enzyme production. This deficiency hampers the digestion process, causing symptoms like bloating, gas, and diarrhea. Undigested food particles may also lead to foul-smelling stools, indicating poor nutrient absorption. Also, pancreatic enzyme insufficiency can result in steatorrhea, characterized by greasy, pale stools due to fat malabsorption. These digestive troubles often accompany abdominal discomfort, highlighting their connection to pancreatic dysfunction. Moving on to sign number 3, unexplained weight loss. While intentional weight loss through diet and exercise is commendable, sudden and unexplained weight loss without lifestyle changes warrants attention. In pancreatic problems, weight loss occurs due to various factors. Malabsorption of nutrients, particularly fats, deprives the body of essential calories, leading to weight loss despite adequate food intake. In addition, pancreatic cancer and chronic pancreatitis can increase metabolic demand and cause muscle wasting, further contributing to weight loss. Sign number 4 focuses on jaundice, a condition characterized by yellowing of the skin and eyes. In pancreatic issues, jaundice typically arises from a blockage in the bile duct, which runs alongside the pancreas. Tumors or inflammation in the pancreas can obstruct the bile duct, preventing the flow of bile from the liver to the intestines. Consequently, bilirubin, a yellow pigment produced by the liver, accumulates in the bloodstream, leading to jaundice. Dark urine and pale stools may accompany jaundice due to the excretion of excess bilirubin through urine and reduced bile flow into the intestines. Moving on to sign number 5, changes in stool color. Pancreatic problems, particularly those affecting enzyme production, can disrupt the normal color and consistency of stools. Malabsorption of fats and other nutrients leads to greasy, pale stools with an unpleasant odor. This occurs because undigested fats pass through the intestines without being broken down or absorbed, resulting in distinct changes in stool color and texture. Reduced bile flow due to bile duct obstruction can contribute to pale stools. Monitoring stool color and consistency can provide valuable insights into digestive function and aid in the early detection of pancreatic issues. Sign number 6 addresses the onset of diabetes. Issues with pancreas can lead to diabetes by affecting the production of insulin. Insulin is a hormone made by the pancreas that helps regulate blood sugar levels. When the pancreas is not working properly due to issues like inflammation or damage, it may produce less insulin or none at all. This can cause blood sugar levels to rise too high, leading to diabetes. Additionally, pancreatic diseases can damage the cells that produce insulin, further contributing to insulin deficiency. Without enough insulin, the body's cells cannot properly absorb glucose from the bloodstream, resulting in high blood sugar levels characteristic of diabetes. Therefore, pancreatic problems can directly impact the development of diabetes by disrupting the normal function of the pancreas and its ability to produce insulin. Moving to sign number 7, nausea and vomiting. Persistent nausea and vomiting can accompany pancreatic issues, particularly when inflammation or obstruction affects the normal functioning of the pancreas. Digestive disturbances, such as enzyme insufficiency or bile duct obstruction, can lead to gastrointestinal discomfort and nausea. In addition, pancreatic pain and associated symptoms may trigger vomiting, further exacerbating the individual's discomfort. Monitoring the frequency and severity of nausea and vomiting, especially in conjunction with other symptoms, can aid in identifying underlying problems of pancreas and guiding appropriate medical interventions. Sign number 8 addresses fatigue and weakness. Chronic fatigue and weakness are common manifestations of pancreatic issues, often stemming from nutrient malabsorption and metabolic imbalances. When the pancreas fails to produce adequate digestive enzymes or regulate blood sugar effectively, the body may struggle to obtain essential nutrients and maintain energy levels. Additionally, the inflammatory processes associated with pancreatic disorders can contribute to fatigue and weakness, impacting daily functioning and quality of life. Moving on to sign number 9, back pain. Persistent back pain, particularly in the upper or middle back region, can be a symptom of pancreatic problem. The pancreas is located deep within the abdomen, adjacent to the spine. In cases of pancreatic inflammation or tumors, the surrounding tissues and nerves may become irritated, leading to referred pain in the back. This pain is often described as a dull ache or pressure sensation and may worsen with movement or changes in body position. Recognizing the association between back pain and pancreatic issues is crucial for timely diagnosis and intervention to address underlying pancreatic pathology. Sign number 10 focuses on itchy skin. Intense itching, particularly on the palms and soles, can be associated with pancreatic symptoms, specifically those involving bile duct obstruction. When the bile duct becomes blocked due to pancreatic tumors or inflammation, bile acids accumulate in the bloodstream, leading to pruritus or itching. This itching sensation is often more pronounced in areas with a higher concentration of sweat glands, such as the palms and soles. Moving to sign number 11, new-onset pancreatitis. Pancreatitis happens when something irritates the pancreas, making it inflamed. One common cause is when the digestive enzymes made by the pancreas become active too early, before they reach the small intestine where they should work. Instead, they start working inside the pancreas itself, which causes irritation and inflammation. Another reason can be when bile, a fluid made in the liver, gets blocked and backs up into the pancreas. This backup can also lead to pancreatitis. Sometimes, drinking too much alcohol over a long time can also cause pancreatitis by damaging the pancreas. When the pancreas gets inflamed, it can be very painful and cause other problems like digestive issues and difficulty regulating blood sugar levels. Lastly, sign number 12 addresses family history. A family history of pancreatic cancer or genetic disorders, such as hereditary pancreatitis or familial pancreatic cancer syndromes, can increase an individual's risk of developing pancreatic symptoms. Genetic predispositions, combined with environmental factors, play a significant role in the development of pancreatic disorders. Therefore, individuals with a family history of pancreatic issues should remain vigilant and undergo regular screenings as recommended by healthcare professionals. Thank you for watching our educational video on early symptoms of pancreatic issues. If you found this information helpful, please consider liking, sharing, and subscribing to our channel for more insightful content on health and wellness. Remember, staying informed is the first step towards maintaining a healthy lifestyle. Take care, and see you in the next video.